So our first speaker is Ed Parham, and Ed is the design director and head of innovation with Space Syntax. The title of the talk is Spatial Tools to Better Manage Places. So with that, I'll hand over to Ed. Thank you.
Thank you. And I'm going to just share my screen, and hopefully everybody, can you see that now? Should be coming through. Yeah, great. Okay, thank you. So there we go. So I'm Ed Parham, I'm from Space Syntax. We're an SME based in London. We were a spin out from UCL originally about 30 years ago, and we're now employee owned. What we're really interested in is the way that the design of the built environment affects day-to-day behavior, the way that has long-term outcomes. And our particular focus is on the use of modeling, taking the urban systems, those hard infrastructure systems, analyzing how they fit together so we can understand those relationships and the way they relate to outcomes. So to give you an example of this, people might have seen this. It was a story on the BBC website 2 years ago now. People had just saved up to buy their first home, but they were really unhappy because they spent the whole time in the car driving everywhere. There was a paper in the British Medical Journal a couple of years ago as well, and that identified associations between higher risk of obesity in people that commuted to work by car. So if you took public or active transport, you had a 10% lower risk of developing obesity. There was more research last year that looked at the secondary impacts of driving on society, and how actually for every kilometre you drive, that has a cost to society, but cycling and walking generate benefits. Now, what we're really interested in at Space Syntax is how we can analyse the underlying urban systems, and we can see how that enables certain daily behaviours to happen or not happen. And the way that we do that, we use spatial data. It's about the hard infrastructure systems. The origin of the company at UCL was about taking the street networks of cities and analysing the connectivity of those networks. And you can, from that analysis, you can understand how people move through a city, where they're more likely to be. And so you can predict pedestrian movement and vehicular movement. That has then secondary impacts in terms of where particular land uses need to be. If you know where people are, things like shops traditionally have needed to be close to people. E-commerce is testing that a bit, but you really need to have access to customers. And so what you find in most cities is that, I think the statistic for London is that 80% of the shops are on the top 20% of the best connected spaces. So that was the core technology that we've been using on real world projects. In the last 5-ish, maybe 7 years, there's been big developments in technology in terms of the amount of data that's available. Software, there's open source software, there's better hardware. Lots of graduates can now code in a way that they couldn't before. And what that means is that you can build bigger models, and they're more complicated. You can analyze them quicker. And that's interesting to people who are kind of really technical. But the key question in this is, so what? And the big benefit that we're finding is that it's a bit counterintuitive, but a more complicated model can actually give you an answer that you don't need to be trained to understand. So this is what we call an integrated urban model. And we take the street network, we link it to land use data, we take public transport timetable data, and we turn that into a network and use that to connect the land uses to each other. We can link it to census data as well. What that means is that you can ask questions that will make sense to somebody who lives in a city. So we can say, for every house in a city, how many jobs could I get to in half an hour? How does that change if I can only use a car, if I can use public transport? Can I get to a good school or a doctor? And to show that in a bit more detail, what I've got here is a model of Milton Keynes. And we have looked at every house, and we've looked at what the advantage of having a car is. Now, these dark blue houses, they can get to 5 times more jobs by car in half an hour than by public or active transport. So we can start to pick out the parts of the town where there is more of a problem. We can go into that in more detail because the model has got the different layers of infrastructure. We've got the street network, public transport, and land use. We could start to investigate how to change that. So we might be able to say, if we just looked at the street network, would a new street through here help reduce the dependence of having a car? But we know that actually adding streets to existing cities is really difficult. It's slow, it's expensive, and it's really unpopular. So maybe you could rule that out. You could look at, we can go into more detail about the land use, and we could say, could we get more land use in this part of the city? You might be able to do that, but again, it might take time. You can then go into public transport and say, could we get a bus route to come through here? But again, because we've got those other bits of data in the model, we can start to see, does it have the density to support a bus route? Does the length, the additional length that the bus would have to go on through those extra bits of street network, does that make it possible to run a bus through there? So we can start to interrogate each of these underlying characteristics to see what is and what isn't possible and what's contributing to this characteristic. A lot of the time we show the data as maps because we're using it in a planning context, but not always. And we pull out the data in other formats when we need to. So this graph is showing basically the number of jobs here you can get to by car compared to the number by public and active transport. And we've got an existing public transport mode share here, which is 10%. Now, Milton Keynes were really interested in seeing, could we test their 2037 plan? So we took the model, we updated it, added in the new connections, the land use, the density, public transport. They had a target mode share of 45% public transport. To hit that mode share, you would want to see the gap between these two peaks get smaller. So you'd want to see the advantage of having a car become less. When we reran the model and updated it, we actually found the gap between those two peaks got even bigger. So the advantage of having a car in future becomes even bigger than it is today, which makes it really difficult to hit that public transport mode share. Now, when we make the models, we put it together in a way that it can be coordinated with census data. And what that means is we can run other models using that data. So here we've zoomed out on Milton Keynes and we're looking at a wider area. The blue is still showing car dependence. And what we've got in different shades of grey in the background is it's an Age UK model of looking at the risk of social isolation in elderly people. So the darker the grey means that the population who live there have got the characteristics that are associated with elderly people who might be lonely. You can then use this to see where are those more potentially vulnerable populations, and do they live in parts of the city where you have to have a car to get to things? And you can use that as a kind of a double red flag to see where are the areas we need to look at in more detail and how should we prioritize the way that we deliver services to these areas. We did a bit of work we worked on an NHS Healthy Newtown with Exeter, and that was really interested in what are the long-term health outcomes and how does that relate to urban form. We worked with the Public Health Department, we gave them a model. This is a different characteristic we're looking at here. We're looking at something called walkability, and that's the way the street grid fits together at the scale of a person and the mix of land uses that you've got within a 10-minute walk. The red streets are the ones where you've got a bigger mix of uses, and the blue is there's fewer uses within 10 minutes. We gave that to the Public Health Department. They had health data that at that point we weren't allowed, and this is their correlation matrix. And what they started to find was that they had higher levels of obesity associated with lower levels of walkability. And there's really interesting, really helpful stuff that comes out of this, and it's in some ways it's the Public Health Department validating the model. There's a really interesting conversation around causation and correlation, which we maybe haven't got time to go into now, but we could pick up in the Q&A. We also we made an integrated urban model of Britain. This was finished in about September, and we did some work with the Prince's Foundation and Knight Frank. This report was published just before Christmas. I think it was December, maybe end of November. And one of the really interesting pieces in there was that the measure of walkability that we found in Exeter related to positive health outcomes was also associated with higher rateable values of properties. So what's really nice, linking those two pieces of work together, is that the same underlying urban characteristics of the way the street grid, the land use, public transport, all of those things fit together to make places easy to walk around or move around without having a car are associated with positive health outcomes and positive economic or value outcomes. So that's a quick introduction to integrated urban models and the way they fit together. And the way that we really apply them is in two kind of key applications. One is to design better new places, and I'll show this in a minute. and the other is to manage existing places better. Now, we were invited to a master plan competition for the capital of Kazakhstan about 3 years ago. We won the competition by using our models to analyze cities around the world that delivered positive outcomes, and to take those characteristics and code them in a computer program that would allow us to grow an urban form that made it possible to walk, to cycle, that was associated with higher values. That was the competition entry. This was what won. And this was the actual master plan that we finished in about September, I think. Now, the last example I was going to show you was one of the things that we recognize is that not all cities are growing, not all cities are physically changing, but we know that the spatial infrastructure and the hard infrastructure underneath the city or within a city or a place or a town is really influential on what happens day to day. One of the things that we want to do is to use that to help people to manage places better. So if you can see that there are parts of the city that present a higher risk, they're more difficult to get to the things that you need to using a car, you haven't got access to the services that you need. We want to be able to use that to identify where there are higher risks, where there are lower risks. Now, this was a project where it was Innovate UK and Newton funded. It was to work with Sao Paulo, and it was to help make a tool that allowed city planners to improve the lives of elderly people in the city. So what we're really interested in is removing the technical barriers to our model so that people can use that to see where are the parts of the city that are more difficult to live in and why are they like this. The thing that we added to this that was really unique was that there were five there was an overall score of how livable different parts of the city were, and we broke that down to explain how easy was it to have social interactions, physical activity, could you get to the health services you needed, could you get to public transport, and we started to introduce in that variation according to the level of physical health and the level of income. What that meant that the planners could do was to ask a series of questions. They could see how quality of life in different parts of the city changed depending on how far you could walk in 10 minutes, what income level you could be at, and how that affected what modes of transport you had access to. This is a tool that is live and it's online here at the moment. We did it for two small parts of Sao Paulo, and that's really about trying to deploy our modeling and technology in a slightly different area to normal, and it's about how can you deliver things on a day-to-day basis. And that is a very quick summary of the work that we do. And I think that the real kind of core point to finish on, I think, is to say what we're really interested in is not just seeing what's happening where, but by analysing the underlying systems, the street networks, the land use of public transport, we can explain why particular things happen in different parts of the city. And when you can understand that, you can either change it or you can mitigate it. So at that point, I'm going to hand back and yeah, we'll pick up any questions.
Okay. Thank you, Ed. Fascinating. I was going to ask one question of each speaker, and then we can take others into the panel. And there are a few that we will take into the panel. But one simple question is, how well can you use this system in a rural area?
Yeah. Well, we've got it analysed for the whole of Britain at the moment. And what it doesn't make a difference between whether you're in a rural area or an urban area. But what it will start to do is you'll be able to really clearly explain the differences of what it's like to live in those different places. So you'll be able to see if you lived in the centre of Milton Keynes, you might be much less car dependent than if you live in a village on the outskirts. You probably have, if you live in a village on the outskirts, you have less good access, or you have less choice of the services you can access, and those kind of questions. So we can start to quantify that and really explain it.